Hello, I'm Sumnima Karel.
Hi, I'm Ashley Jovolanos.
I'm Jeannie Kissy, and we will be doing our project on myasthenia gravis.
The annual incidence of MG is 6 per 100,000 populations, and currently there are about 18,000 people with myasthenia gravis in the US. The age of onset is variable. MG currently affects young women with dominant peak of 40 years, which is an early onset of myasthenia gravis. A second peak of incidence comes between fifth and sixth decade, which is also the late onset of myasthenia gravis, affecting men more often than women. In patients younger than 40, women predominate with a ratio of 7 to 3. In fifth decade, new cases of MG are evenly distributed between men and women. After age of 50, new cases of myasthenia gravis are slightly more in men than in women with a ratio of 3 to 2. Myasthenia gravis can be triggered by temperature extremes, and it can be high in places like Arizona and Alaska, which should be avoided. Myasthenia gravis is an autoimmune disease, and it is not confined to one specific region of the United States. Chances of HPU community getting the disease are slim because the HPU community is almost 3,000. MG prevalence rate is 1 out of 17,000 people, but if you look at the Houston population, there can be 180 people suffering from myasthenia gravis in Houston population of 3.3 million.
Myasthenia gravis is an autoimmune disease of the neuromuscular junction characterized by the fluctuating weakness of certain skeletal muscle groups. The name itself means grave muscle weakness. Myasthenia gravis is caused by a defect in the transmission of nerve impulses to the muscles. It occurs when normal communication between the nerve and muscle is interrupted at the neuromuscular junction, which is the place where the nerve cells connect with the muscles that they control. Normally, when impulses travel down the nerve endings release a neurotransmitter called acetylcholine, and acetylcholine travels from the neuromuscular junction and binds to acetylcholine receptors, which are activated and then stimulate a muscle contraction. In myasthenia gravis, acetylcholine receptors at the neuromuscular junction are attacked by antibodies, which prevents the muscle contraction from occurring. These antibodies are produced by the body's own immune system. Myasthenia gravis, therefore, is an autoimmune disease because the immune system, which normally protects the body from foreign organisms, mistakenly attacks itself. In this disease, anti-acetylcholine receptor antibodies are detected in the serum of 85 to 90% of patients. In the remaining 10 to 15%, tyrosine kinase receptor autoantibodies may be found. Thymic tumors are found in about 15% of patients, and abnormal thymus tissue in most others is found in most others, probably because the thymus gland is important in the development of the immune system in early life. The primary feature of myasthenia gravis is fluctuating weakness of the skeletal muscle. Strength is usually restored after a period of rest. The muscles are generally the strongest in the morning and become exhausted with continued activity, so therefore by the end of the day, muscle weakness is prominent. Although myasthenia gravis may affect any voluntary muscles that control eye and eyelid movement, facial expression, swallowing, and breathing are the most frequently affected. Symptoms, which can vary in type and severity, may include drooping of one or both of the eyelids, which is called ptosis, blurred or double vision diplopia, due to weakness of the muscles that control eye movements, unstable or waddling gait, a change in facial expression, so they might have a flat affect, difficulty swallowing, otherwise known as dysphagia, shortness of breath, impaired speech, or dysarthria. So in this, the voice may fade after a long conversation. So risk factors are the ages of between 10 and 65 years old. It's twice as common in women than in men. And in men, it's more common greater than 60 or older than 60 years old. The peak age at onset in women is during the childbearing years. And also another risk factor is if they have abnormal thymus tissue or if they have a thymic tumor.
Myasthenia gravis is diagnosed by a history and physical exam. It also uses an EMG and a tensilon test. An EMG is where they use a single fiber, which transmits a signal that shows a decreased response to stimulation of hand muscles, which also indicates muscle fatigue. A tensilon test reveals improved muscle contractility after an IV injection of tensilon, which is an anticholinergic agent. This test also aids in the diagnosis of cholinergic crisis, which also occurs when there is too much cholinesterase inhibition. In this case, tensilon may increase muscle weakness instead of decreasing muscle weakness. Atropine should also be readily available to counteract the effects of tensilon when it is used diagnostically. Myasthenia gravis cannot be prevented, but you can avoid triggers such as emotional stress, pregnancy, menses, another illness, trauma, temper extremes, and also hypokalemia, which could be from vomiting. And this helps patients prevent the exacerbation of myasthenia gravis. There are two main therapies for this disease. There's drug therapy and surgical therapy. Drug therapy, they use anticholinerase drugs, which are aimed at enhancing the function of the neuromuscular junction. Pyridostigmine is the most successful drug in this group with long-term treatment. You can also use alternate day corticosteroids, which are often given to suppress the immune response, and they most specifically use prednisone. And you also use immunosuppressants such as azithromycin, myophenolate, and cyclosporine. Some contraindications for the drugs are anesthetics, antidysrhythmics, antibiotics, quinine, antipsychotics, barbiturates, and sedative hypnotics, cathartics, diuretic, opioids, muscle relaxants, thyroid preparations, and tranquilizers. They're not recommended to use these because they have various effects on the body. So as far as surgical therapy, you can remove the thymus gland because it appears to enhance the production of anticholinerase antibodies, and that surgery is called a thymectomy, and it's indicated for most patients with thymoma, for patients with generalized myasthenia gravis between ages of puberty and about 65 years old, and for patients with ocular myasthenia gravis. Another therapy they use is called plasmapheresis, and that can yield short-term improvements in symptoms. And it's also indicated in patients with crisis or in prep for surgery when corticosteroids must be avoided. Some effects of this disease on multiple dimensions of health include it can result in myasthenic crisis, which occurs when the muscles that control breathing, the intercostal muscles, they become too weak to do their jobs. This needs emergency treatment to provide mechanical assistance with breathing, so like a ventilator. Some considerations to take into account are if you have a strenuous job. you may need to look into getting a new job or possibly working in a different area of that job, because you can't be, or you don't want to overexert yourself during the day, because that can exacerbate or can result in myasthenia crisis. And then also, it is important to maintain a balanced diet with food that can be chewed or swallowed easily. You don't want to work real hard at chewing food. You would rather use your energy somewhere else. And also, another thing to consider is making or taking your medication, setting out the peak, and you want to make sure the peak coincides with your meal time. That'll also help with fatigue. You can also need to consider or plan out activities or just regular activities of daily living that require less physical effort, because you don't want to use all your energy all at once.
Most individuals with myasthenia gravis have a normal life expectancy. With treatment, most individuals with myasthenia gravis can significantly improve and manage their muscle weakness and lead normal or nearly normal lives as long as the medical regimen is followed as prescribed. Some cases of myasthenia gravis may go into remission either temporarily or permanently. As with any other disease, it's always best to be positive and to not let the disease define who you are. A few resources for emotional support. One of them is Muscular Dystrophy Association, or MDA, and it's an example of one support group for myasthenia gravis. They fund research projects and search for additional treatments and therapies. They help individuals, families, and caregivers connect with other members of the myasthenia gravis community. Their website is www.mda.org. Another resource is called the American Autoimmune Related Diseases Association. AARDA is the only national nonprofit health agency dedicated to bringing a national focus to autoimmunity, the major cause of serious chronic diseases. And their website is www.aarda.org. There's also one more example, and it's called Myasthenia Gravis Central Texas Support Group, and it's in Northwest Austin. And their website is www.mg-centraltexas.org.
Physical therapy and occupational therapy helps the individuals to strengthen and facilitate to return to activities of daily living and or return to work. Physical therapy is also beneficial for long-term restoration of muscle strength. When an improvement is noted and the exercises are well tolerated, the intensity and progression of exercise should be changed depending on the stage of individual's disease and or his or her overall health. Isotonic exercise is recommended. The amount of resistance is determined at a point when individual's final repetition is difficult but doable. Occupational therapy may help the individual adapt to new ways of performing specific domestic and occupational tasks. Speech therapy may be used as a facial or throat muscles become weak, or if individuals need to be trained on esophageal speech, following a permanent opening in the throat or windpipe or tracheotomy. Psychological interventions may be necessary to help the individual cope with the effects of the illness.
Okay. Thank you for watching our presentation.